Looks like a lot of folks are joining us now. We'll get started in about 30 seconds just to give time for folks to trickle in. Okay, we can get started. Hello, everyone. Hope your day is starting well. I am Christina Zuniga, Senior Program Manager at Health Leads and co-lead of the Amplifying Impact Initiative Pillar 2. I want to give you all a warm welcome and thank you for joining us to our Request for Information session webinar, where you will learn about the initiative's intent, the eligibility requirements and funding priorities, key proposal components and expectations, and you'll be able to ask questions directly to the HCAI and the Health Leads team present here today. Next slide, please. In our 1 hour together, you will hear from the California's Department of Healthcare Access and Information, also known as HCAI. Ann Bowie from HCAI will be joining us, and she's the state policy specialist, not police, policy specialist, who will provide background on Pillar 2. And then next, you will hear from my colleague, Kusi McKenzie, Director of Strategic Initiatives at Health Leads, as she will provide an overview of the RFP. We will then move on to a Q&A where the attendees will be able to post questions on the Q&A box. You'll see the Q&A box on your bottom right. It says Q&A. Please drop in the questions there. And then finally, we will close out with relevant reminders and next steps. Okay, general housekeeping. So again, please use the Q&A function to post questions. Again, it's at the bottom right. Please avoid adding questions on the chat as we want to make sure we don't miss anything, as we will be reading the questions from the Q&A box directly. This session will be recorded and shared with all registered attendees. All questions and responses will be shared via public Q&A by March 20th. So any questions and all the information shared today will be shared with you all who are registered for this webinar. Next slide. And again, today's presenters, as mentioned, it's myself, Anne, and Kusi. And I will then pass it on to Anne to talk about Pillar 2 background.
Yes, thank you, Christina. And hello, everyone, and thanks for joining us. So we're excited to walk through HCAI's Community Health Worker Promotor and Representative Initiative and set the stage for Pillar 2, which is the focus of today's RFP session with partnership with Health Leads. So we just want to start with grounding HCAI's mission and vision. So we want to make sure that we are aligned with the vision. That's going to be the scope of this work that we're focused on. So HCAI's vision is California, where every community has equitable access to health quality, culturally responsive healthcare. Our mission is strengthen the state's health workforce, expand community capacity, and improve care delivery across all regions. This commitment to equity and community-centered care is the foundation of the CHWPR initiative. So on the next slide, we'll take a look at HCAI's broader workforce efforts support this vision and through their work here. So within HCAI, the Office of Health Workforce Development leads statewide efforts to build and sustain a diverse, culturally competent health workforce. This includes expanding training opportunities, strengthening career pathways, and investing in the infrastructure needed to support health workers across the state. These efforts ensure the workforce reflects the cultural and linguistic diversity of California's communities, and they create the foundation for the CHWPR initiative. So on the next slide, we'll take a look at the purpose that guides all of this work here at HCAI. So HCAI's workforce purpose is to develop, support, and expand a health workforce that serves medically underserved areas, supports Medi-Cal members, and reflects the diversity of California's population. The CHWPR initiative is one of the key ways we advance this purpose, And by investing in trusted community-rooted workers, we strengthen outreach, navigation, health education, and the connections that help individuals and families access essential services. So with that purpose in mind, let's take a look at the initiative itself on the next slide. So the CHWPR initiative strengthens California community health workforce by supporting culturally rooted, trusted messengers and building the organizational capacity of community-based organizations. These investments advance health equity statewide by ensuring communities have access to workers who understand their language, culture, and lived experiences. So to understand how this initiative is structured, let's briefly walk through its four strategic pillars on the next slide. So this initiative is organized into four pillars. Today's focus is on Pillar 2, and Pillar 2 is designed to strengthen and expand CHWPR training and organizational capacity across the state. It builds on two major foundations. First, the California Healthcare Foundation's Amplifying Impact Initiative, Cycle 1, which has demonstrated the power of community-led, culturally grounded training, trauma-informed approaches, strong organizational and infrastructure, and curriculum rooted in lived experience. Pillar 2 will continue building upon these models to scale them statewide. Second is Pillar 2 responds directly to what we heard in community dialogues. So the need for flexible training pathways, recognition of lived experience, CHWPR well-being supports, organizational capacity building, and culturally and linguistically responsive approaches. So let's take a brief moment to review what we've learned from our statewide outreach on the next slide. So before designing the initiative, HCAI conducted extensive statewide community dialogue sessions with nearly 700 community-based partners, CHWPR representatives, and stakeholders. Their feedback was clear. Training must be culturally and linguistically aligned. Community-based organizations need more capacity to scale training, and training entities need support beyond the curriculum, such as supervision, infrastructure, and evaluation. So CHPRs also emphasize flexible training pathways, recognition of lived experience, support for well-being, and long-term investment for sustainability. These insights shape the four-pillar structure and design of today's funding opportunity. For the past 4 years, the California Healthcare Foundation has invested deeply in expanding and sustaining the CHPR workforce. And so through this, they have been supporting more than 60 organizations. Their leadership has elevated the expertise and lived experience of this workforce as essential to advancing health equity. As California Health Care Foundation transitions leadership of this initiative, HCAI is honored to partner with Health Leads to carry this work forward through the next phase of the Amplifying Impact Initiative. So with Health Leads partnership, this next iteration will support organizations in strengthening community health workers, promotores, and representatives workforce, sustainability, and building organizational capacity through workforce support services and strategic infrastructure investments. We are grateful to California Healthcare Foundation for seeding this work and grateful to our partners with Health Leads as we expand and sustain it through the HCAI Community Health Workers, Promotores, and Representatives Initiative Pillar 2 funding. And with that, I'll pass it back to our partners at Health Leads for the request for proposals overview. Thank you.
Thank you, Anne. Hi, I'm Kusi McKenzie, Director with Health Leads in the Strategic Initiatives Office. So I'm going to give an overview of the request for proposals. All right, so this request for proposal is really to solicit proposals from qualified organizations to implement initiatives that enhance CHWPR workforce sustainability and strengthen organizational capacity through CHWPR workforce support services and infrastructure investments. I also want to note that this funding is not a grant and it is a contract opportunity. And the opportunity structure is a contract because the scope of work requires defined deliverables, performance expectations, and ongoing coordination that align more closely with the contractual agreements rather than grant making. This structure allows us to ensure consistency, accountability, and timely implementation across all awardees. And also with that said, this is not an ideal funding source for those who seek to redistribute funds to other entities in their network. So for example, if you're in an association that's made up of member organizations, um, this is due, so if you're made up of member organizations, the member organization should really be the applicant entity. And this is due to the nature of the contract and the funds being subject to state audit. So the funds need to be traceable and tied to work performed by the awardee or their consultants. So right now we're accepting questions through Friday, March 13th. All questions received via email to the address seen there on the screen, as well as questions posed today will be compiled into a master Q&A document. That Q&A document will be distributed publicly by March 20th. If you send questions via email, please note that you will receive a receipt confirmation. However, we cannot answer questions via email or give advice to your approach. So please note any questions posed and the response will be public. The deadline is March 30th. For all submissions, late applications will not be accepted or reviewed. Our target date to select awardees is April 24th, but please be aware that this date may vary depending on the volume of applications we review. There's over 500 people on this call, so that's an indicator this is going to be a very competitive process. So please be patient and bear with us. And if there's any changes or updates to the target date for selection of awardees, we will reach out directly to the email that is submitted within the application. All right, so for general information, the performance period for this initiative is about 18 months, running from May to November 30th. So be sure your scope of work and budgets reflect that performance period that you see on the screen. Award amounts will be up to $250,000. The number of awards will depend on the volume and quality of applications received. For the programmatic information, so this initiative is centered on investing in the CHWPR workforce. So 51% of total funding must go towards workforce support services. There is a non-exhaustive list within the RFP announcement document of what is considered workforce support services. The remaining 49% can be used for infrastructure necessary to implement the activities within the scope of work. Please note that the 51% is a minimum, and applicants are welcome and also encouraged to put greater investment into workforce support services. Okay, for eligibility, this opportunity is open to nonprofit, for-profit, local government, and tribal entities located within California that employ or directly support CHWPRs. So this includes community-based organizations, educational institutions, workforce development organizations, and other entities with demonstrated experience, either employing or training CHWPRs, doing community engagement, or serving priority populations. Also, ideal applicants that have strong community partnerships, cultural and linguistic competency, and capacity delivering training alignment within the RFP requirements. So this is open to a very wide pool of applicants. We've already received some questions around if folks need to employ CHWPRs to be eligible. Entities don't need to employ CHWPRs, but they have to have the intent to employ CHWPRs. And with that, there must be explicit information given of how these employees will be retained past the 18 months and when the funding is gone. All right. And also you don't have to be a Medi-Cal provider to be eligible for this opportunity. So although there's a wide pool of eligible applicants, there is going to be priority given to community-based organizations with demonstrated community trust, equity focus, and linguistically responsive programming. There is an RFP question guide, so please use that as a resource. Even before you start your application, it lists all the questions within the application, and along with the RFP announcement, those should really be key documents to probably answer many of the questions that folks have. So I'm going to move on to the Q&A, and we'll open up to questions from attendees. Again, please use the Q&A function. I'm going to stop sharing, and we'll get started on hopefully answering some of your questions. Okay. And if we can't answer your questions or it's very specific to your organization, please note that all the questions posed here will be going into the Q&A document. So it will be responded to, even if not in this space. All right, so we'll start from the top. Would supporting community health workers with intergenerational healing and trauma-sensitive stress management constitute capacity building or fit into any other categories for this opportunity? I believe that question is organizational specific. So I don't believe that's one we can answer. Okay, will applications with organizations partnering together score higher or be prioritized? When we go into, we can only contract with one entity. So if there's two entities that are close partners, one entity could be a consultant for the other, but we cannot go into contracts with multiple entities under one award, I should say. Are all Q&A due by 3/20? No, they're due by this Friday, March 13th. What's due is so March 13th is the due date for all questions, and then we will make the Q&A document public by next Friday, March 20th. Will applications for those who were granted the first round score higher or be prioritized? No. It's all going to depend on the quality of the applications, and so there's no priority given to those folks that participated in the CHWPR initiatives, the prior initiatives. Can you explain more about eligibility? When I click on the link, it sign issues. So we know there's been some technical issues. I believe Christina has dropped all of the RFP documents within the chat.
I will drop it. Yes.
Oh, she's about to.
I'm going to drop it. Yes.
And then also we put up she'll also drop the email address, the Amplify email address for Health Leads, and just shoot an email to that address, and I'll be sure to send you all of those documents. So we know there's been some technical issues as those files are shared in SharePoint. If we have plans to offer CHW, but do not yet offer the services, are we eligible for this funding opportunity? So I'm reading that as you plan to offer CHW services. So yes, you will be eligible, but it needs to be explicit within the application on how these services, and if it's linked to employing new CHWs, how those services and those employees will be sustained after the end of this initiative. Okay, given the range funds up to 250,000, how many contracts are you generally anticipating to accept? We don't have a set number. That's going to depend on the volume and the quality of the applications received. And just it's up to 250,000, so it's up to the entity to create a budget and a scope of work of the funds that they need to execute what they're proposing. Okay. Can anyone on this call answer this question? Can a CHW have an office space anywhere, or are they required to be on site at RHC? Okay, I don't think that's appropriate for this space. Okay. Are non-licensed staff as qualified as CHW or promotores? What is the qualification, certification, lived experience hours? It seems like this is a question tied to certification and not this RFP. Okay, if they are, can we include supervision? Okay, this is a continuation of the last question. Um, okay, approximately how many contracts are expected? I've already answered that. There is not a set number. Um, are there certain minimum number of CHWs we have to supervise and host? There's not a minimum number, but we do ask how many, if you employ CHWs, we ask how many CHWs are in non-supervisory roles. So we are looking at that distinction. Is part of the funding to provide a stipend to the CHW? If so, is there a limit to that? You can use the funds to provide stipends to CHWs, and that fits within the 51% of the CHWPR supported services. Does HCAI, if staff want to do peer specialist route, can HCAI cover the fee?
Yeah, given that's a very specific question, we'll circle back to that one, but we won't be able to answer live at this time.
Okay, thanks, Anne. Oh, that's a long one. All right. We have a network of home visitors and CHWs that collect data on outcomes and impact. We do not intend to compete with those in the network employing CBOs who hire CHWs to apply themselves. We do want to support their efforts for time to enter data through stipends and determine appropriate impact measures, amend our existing shared data systems to incorporate these new measures and focus our application on the next level up of data collection to show CHW impact in the county as a whole. Is this an appropriate application? Or does it not meet your requirements of who may be awarded? A network of home visitors and CHWs. So I think this kind of goes back to what I said about associations. It should be a single entity. I mean, it's fine if they're CHW employees or seeking to employ CHWs, and if you want to have your proposal or your approach around data collection, I mean, that's up. I can't advise on approach, but I hope that answers the question. Okay, how do we access the application overview? We currently don't have access, so Christina will drop those documents in the chat, and then we'll also put up the email address again. So for some reason, if you can't grab it from the chat, just shoot us an email and we'll get those to you as soon as possible. Can we apply it as lead when another organization is putting us on their application as a sub-grantee? So I think this goes back to this is not ideal for entities to do subgrants because of the state auditing, or this being subject to state auditing. If you want to partner with an organization, someone needs to be the lead entity, and they can list you as a consultant to support the work. So I think that's going to be up to yourself and the other organization to figure out who wants to be the lead entity. Do you have a sense of what reporting metrics are? The reporting, you should look at the budget, the scope of work, and the budget template. Both of those templates, the reporting is going to be structured around the activities and the budget tied to those activities. So I think that's a good place to look in terms of the structure, and also the content you put in there is what you're going to be held to deliver on, and that's going to be tied to your payments. Reporting will be on a quarterly basis. Are academic institutions eligible? Yes. Is there a PDF version of the RFP? Yes, it should be inside the chat. Again, shoot us an email if you need a copy of that. Okay, this is access to let's skip that. We've already answered how many, we don't have a number of contracts that's going to be awarded. Must applicants serve Medi-Cal members only? Nope. What about agencies that serve uninsured people? Again, the eligibility requirements are in the RFP announcement. Basically, only federal agencies are not or can't apply, or another like state government can apply, or even another California state entity that's beyond local government can apply, but it's pretty open aside from those type of entities. Priority will be given to CBOs over local government explicitly. CBOs will be given priority over everybody. So that's explicitly stated in the RFP announcement. And also here, of course, the CBOs have to meet that criteria of being community connected, having equity rooted work, and being linguistically inclusive in how they serve and how they serve their community. Are managed care organizations eligible to apply for this grant? Anne?
They only would be eligible if they meet their criteria within the RFP announcement. So yes, they are eligible only if they can check all the boxes of the requirement RFP.
Thank you.
Mm-hmm.
All right, are nonprofit Medi-Cal community care hubs eligible? Yes, they're eligible, but again, this is not an ideal opportunity if the funds are planned to be distributed among other entities within the hubs. It is really appropriate for the actual hub entities that hire, train, or support CHWs directly. So if the hub entity itself hires CHWs, especially those that are in non-supervisory roles, and provides direct services, then yes, but not for redistributive funds to member entities. Okay. Can this funding be used to help retain existing CHW type staff by covering a portion of their salaries and related costs, as well as things like paid training time, enhanced supervision, wellness supports, as long as at least 50% of our budget is clearly going to CHW PR workforce support services? The answer to that is yes. Are activities implemented by a collaborative, not auditable by the auditable by the state? Implemented by a collaborative. The activities that are implemented, they need to be implemented by the entity that is contracted. So the contracting entity may have consultants that support their work, which is fine. It's just that we need to be able to trace the work within the scope of work and those activities to the budget. So if your consultant happens to be a collaborative, I think that's up to the applicant. So hopefully that answers the question. But it is going to be a contract with the entity, and they're expected to meet the activities, whether themselves or through their consultants. The link to the application overview requires Health Lead sign-in, so we've addressed that. Okay, each subcontract must allocate 51%. It looks like someone just copy and pasted part of the RFP announcement. Okay, what were the things a CBO needed to have to be prioritized again? So that is in the RFP announcement, but um, a demonstrated community trust, equity focus, and linguistically responsive programming. So like I said before, use the RFP guide, the question guide as a resource because there's all the questions that are in the application. So you can review that before even deciding to apply. And you'll see questions in there that applicants have to demonstrate the trust and demonstrate the equity and demonstrate the community connection and how they're responding, because that's what reviewers or the evaluators are going to be looking for to substantiate those claims. I don't see the RFP guide. So Christina is dropping them. Do you drop all the documents again in the chat?
Yeah, it seems like some folks are still having a hard time opening it. So I am gonna try to download a separate copy from straight from my computer and see if that helps. And then also I dropped the email. It's amplify@healthleadsusa.org. Please email that directly if you still have a hard time accessing them, and I will send you a copy directly.
Thanks, Christina. And sorry again about the technical issues. Okay. Our organization provides stipends to youth promotores. Does this fulfill the employee requirement? I guess that depends if the youth promotores are your employees. So that question needs a bit more context. But from the question, it seems like you provide direct support, which stipend seems like direct support to CHWPR. So from what's provided, there's no employee requirement actually. So, but you are eligible from what's stated there. Are fairly qualified centers eligible to apply? Yes. So the funding can directly support the staff in the CHW role if they are currently working within our communities with other funding sources, correct? Yes. Okay, this is all RFP requests. So again, send an email to that address to the amplify@healthleadsusa.org and we'll send you all the application documents. The application is due on March 30th. We've already answered that question. Can you elaborate on the role of membership organizations in this contract? Am I understanding correctly that we should just encourage each individual member org to apply individually? Yes, and that's a short answer. Like if you're in a same thing, I guess, with the hub or associations, um, this is not ideal to apply for this funding in order to redistribute funds to those entities within your association or hubs. The hub or the association itself is eligible to apply if they directly employ or support CHWPRs or provide training and want to expand that work and amplify that work in that workforce. But this is not appropriate for redistributing funds. And of course, this goes back to the audit trail because all these contracts are subject to state audit and all the funds need to be explicitly tracked to the folks doing the work. Okay. Can you expand on eligibility around intent to employ CHWPR? What if we have a training program specifically for this population, but do not internally employ CHWPR? So training entities are definitely eligible to apply because you are providing direct support to CHWPRs, even if that's not through employment, it's through the education. And the training entities, just like all the other applicant entities, are subject to the community connectedness, the equity focus, and linguistic inclusion. So especially if you have a training entity that maybe provides CHW trainings in various languages, that's reflective of the communities that your CHWPR serve, or provide materials in different languages. So definitely training organizations are more than welcome to apply because they directly support this workforce. All right, I'm trying to see where I am. Okay. All right, looks like I got moved all the way down to the bottom of the questions. The application mentions required convenings and learning opportunities. Can you expand on that and whether those requirements are likely to change? No, they're not going to change. So in addition to the work you put within your scope of work, there's going to be other initiative activities. There will be a series of webinars. Also, there's going to be peer collaboration. There'll be peer collaboration convenings, as well as a formal evaluation. So there is an expectation that the contracted entities are willing and able to participate in those activities. Okay. In the question guide, my region, Northern California, was not listed. Are we eligible? If you're in California, you're eligible. How are CHWPRs defined? For example, is DV case management considered a community health worker? And I don't know what a DV case management is.
Yeah, they're talking about domestic violence case
Mm,
managers, and so it really depends on your organization and what is defined. Are they community facing? If you look at our HCAI CHW initiative, there is a clear definition of how we see community health workers, promotoras, and community health representatives. So as long as your DV case managers are working within those areas of really community facing, health navigation, all those supports as defined by CHW and Promotora's work, then needs to be reflected in your application. So it really depends on how you manage and work with your DV management and case managers, because they have to fall into the definitions of a community health worker, promotora, or representative. So I highly encourage you to review the definitions that's included in the RFP process eligibility, as well as the roles that are defined in the community dialogue reports that we received through the HCAI initiative. And I'm happy to type the answer of the roles defined in there so you can match with that.
thank you, Anne.
You're welcome.
All right, is peers certification training allowed? Yes, if it's for your CHWPRs. For CHW, what are the hours or hours of experience that count towards this position? I don't think that's a question for this RFP. Are volunteers considered part of the workforce? Um, if you're, yes, if there's CHWPRs and serving in a CHWPR role, even if they're unpaid. Do 51% of our funds go toward the project if funded? Or is that, as an organization, 51% of our org funds? The 51%, that is the project fund. So so the total award, 51% of the funds need to go specifically, at minimum, go to CHWPR support services. And again, those are listed within the RFP announcement. Would a nonprofit public entity, government entity be eligible? Yeah, if it's local government. Let's see. Can you please provide example support services for CHWs? Those are listed within the RFP announcement. Okay. Does the proposed budget and scope of work have to cover 18 months? Yes. What are the focus areas specifically? Can you put that slide back up? They are the focus areas with the infrastructure and the CHWPR support services are documented in the RFP announcement. What if I want to offer a class to the community to get CHW certified? Is the funding available for this? Training entities are eligible, so yes. Can you please clarify if nonprofits that are fiscally sponsored will be eligible to apply? I believe so. And
As long as they meet the requirements of the RFP and they are fiscally sponsored as a nonprofit community-based organization, it should be fine.
okay. Okay. Do you encourage co-applicant leads? No. Just to clarify, we don't need to only be a service provider, but CBOs with CHW navigators could apply for the contract. We're looking for entities to apply. Hopefully I'm understanding that question right. We don't need to only be service providers, but CBOs with CHW navigators can apply, yes. And we're encouraging community-based organizations to apply. Let's see, the application overview link. Okay, so that's access to the documents. Again, send us an email and we'll get you those documents as soon as possible. Would nonprofit, oh wait, can you share the link to the CHW definition page by HCAI? Yes, we'll share that in the Q&A document. Okay, the application overview link. Oh, sorry. Okay. The Amplifying Impact website will connect 28 CHW Medi-Cal providers to grants. However, the presenter mentioned that the number of awardees. So this this question is referencing the 28 organizations that are currently funded by the initiative. This is not the RFP that we're speaking of right now, which will be a continuation of the Amplifying Impact Initiative, but with a new set of awardees. Can you repeat if this is ideal for subgrantee or just for our own? Yeah, this is not ideal for this is not ideal funding for subgranting. Does 51% of support services for CHWs include staff time and or independent contractor payments for CHWs? Yes, but I believe you're. And is staff time part of the infrastructure? I believe so. That'd be part of the 49% and not the 51%. The 51% is really the investment into the actual CHWPR employees. Or if there are, I guess, independent contractors. So there's a space on the budget for consultants. So yeah, I don't know. And do you have any insight into that one? If their CHWs are independent contractors, should those folks be listed as consultants, or is that just like an entity where we're just will be
Yeah,
grouped as CHWs?
Yeah, this one will probably have to circle back because this is very unique to your organization, how you structure your request for the proposal. Again, as outlined in the RFP, the goal is to invest in the CHW workforce. So training components, training entities to make sure that they have the resources needed to sustain their work as a community health worker in Promotor, serving their communities throughout California. So it really depends on how you structure your particular proposal and how you will utilize the CHW PR workforce to either complete their training, to either sustain their work as a CHW PR beyond the funding cycle, and how you build their knowledge base to either advance in their work and opportunities for them to continue serving the communities as a CHW PR. But again, we'll circle back in the FAQ document because this sounds like it's very unique to your particular structure or your project proposal.
All right, thanks, Anne. Can the CHW focus on multiple barriers to care, or is it best to focus on a particular area? That's going to be up to you all as the applicant of what you want to propose as your activities and your focus areas. Let's see. How does Pillar 2 different operationally from Pillar 1? So these are going to be, these are going to be contracts and not grants. And so we gave some details in the beginning of how that differs. And
Yeah.
sorry, go ahead, Anne.
Yeah. And just to add a little context there, Pillar 1 is focused on immigrant health and resilience. Pillar 2 is more broad scope. So if you are a Pillar 1 grantee or recipient, you are eligible to apply for Pillar 2 as long as those two activities do not overlap, because we don't want to have a double dipping of that, because we want to make sure all the funding is supportive and available to our CHWPR workforce and the network. So if you are receiving funding for Pillar 1 work and you have additional CHPs who would like to build upon training, as long as it's not overlapping with what the activities and the program deliverables of Pillar 1, you're welcome to apply for this RFP round for Pillar 2 funding. So as long as the activities don't overlap or continue on that.
Thanks, Anne. And I was reading that's Initiative 1, not Pillar 1 and 2. So thank you. Oh, okay. Would a membership-based organization that provides training to CHWP be eligible? Yes, training entities are eligible even if they don't employ CHWPRs because they're doing direct support services. Can funds be used primarily for CHW service delivery? Yes. Okay, can you please clarify whether the requirement 51% allocation includes staff salaries and benefits for CHWPR positions? Yes, if it's a direct investment in the workforce, that will count towards the 51%. Is there a way to view the entire application without having to fill out? Yes. As I mentioned, it's the application guide that has all the questions in the application, because the application itself is on a Typeform platform. And so we created the guide so folks can prepare all their questions ahead of time before opening up the actual application in Typeform. And also it's just a good guide to see what's expected and how you have to demonstrate what's being asked within the RFP. Okay. All right. These are access issues. Will the project be administered by HCAI? No, it's going to be administered by Health Leads. Okay, I think we already answered that around CHW. CHW time is considered part of the 51% of the budget. Okay. Could CBOs utilize the funds contracts to build a new CHW program within your current organizational work? Yes. Do we need to use the template suggested for scope of work and budget? Yes. Does the organization have to be preparing to be a Medi-Cal provider? No, you don't have to be preparing to be a Medi-Cal provider or a current Medi-Cal provider to be eligible for this opportunity. As an FQHC, we cannot bill for CHWs, but do have care coordinators. Our organization values individuals with lived experience that includes case management, peer support. We can see CHWs align with peer support. There's an opportunity to work with local community college to build a pathway for entity workers. Is this a project that could be awarded? I can't say that, but your FQHCs are eligible to apply. So it's going to be up to you to demonstrate that and how that work or your approach aligns with what's being asked in the RFP. Our contracting process requires Board of Supervisor approval. We'll need to have proof of approval for the application. Wait, will we need to have proof of approval for the application? Or can we wait until we're approved to take the contract to our Board of Supervisors? So for Sarah, please send an email. We will have a sample contract, hopefully available in the next week or two. So if it's helpful, we can send that ahead of time to help with that board approval process. But you don't need to have your Board of Supervisor approval in order to apply. But with that situation, we know sometimes a sample contract is helpful. So just please reach out to the um, Amplify email, and I'll keep you posted on that when it's available and get that to you. Okay. What is the total amount of funding available? It's up to 250,000 per contract. Is there a way you can share and cooperate with organizations throughout California who are applying with or without winning the grant? Sure, I think that's up to you as an entity. But as stated before, we'll be going to contract with a single entity. So it's up to your organization of how you want to partner or act as a consultant for other entities. Let's see, can the direct support for CHW section 51% include salaries? It depends whose salary. If it's salary for CHWs, then yes, it's part of the 51%. If it's like support staff, project manager, or other folks, then that's the infrastructure, that 49%. Is it allowable to apply under more than one application? For example, is it possible to be awarded a contract directly as well as a subcontract other another organization's contract? You can serve, so yes, because you can be awarded as a single entity, and then also if you provide consulting services and another applicant wants to use you as a consultant, then that's up to you. But like we said, subawards are this is not an opportunity for subawards. Are specific program outcomes expected? Numbers you want to see reached? No, there's no specific outcomes. When you do your scope of work, the entity is defining their activities, their objectives, and the work they want to engage in. Okay. Are the only two narratives the scope of work and budget narratives? There is no. So yes, the scope of work and the budget have narratives, but also within the application, there's open-ended questions. So again, use that question guide as a resource. And no letters of support are not required. But if you do have them, we do have a space within the application where you can upload them. Is the ultimate goal of the RFP to find employment for CHWPRs, or does education training opportunities for these populations weigh as heavily? The ultimate goal is investment into the CHWPR workforce, whether that is through employment or it's through education. So yes, I would say to the weighting once it's an investment. That's what this is about, is investing in this workforce. Okay. Is there a region of California that will receive funding priority? No. Does the agency need to serve a minimum number of CHW PRs? No. However, um, we do ask for a distinction of how many CHW PRs that you employ that are in non-supervisory roles. Okay. If a group of local government agencies, along with their local CBO partners, submit one proposal for a regional project, would it be possible to apply for more than 250,000? No. And again, we're advising that only one entity apply because we can only go into contract with a single entity, and subawards are not really appropriate for this type of engagement. Okay. Also, and I think this is probably the last question. Also, as a first-time applicant, if we send you draft documents, are you able to give feedback? No. Can we be included as a subcontractor to a primary organization if we offer technology-based clinical decision support tools? Yes, you can be listed as a consultant if they're utilizing your technology or the services you offer to execute work that's stated in their scope of work and their budget. Let's see, can orgs apply to this round pillar 2 if they didn't apply for the first round pillar 1? Is that yes? Yeah.
Yeah, because
Okay.
yeah, as long as you meet all the RFP eligibility requirements that's outlined in there, you're welcome to apply.
All right. I want to have 2 minutes left. Ooh, thank goodness my voice. I haven't done this much talking in a while, and Christina knows I yap. Okay. Should Pillar 1 grantees and their subgrantees submit applications separately or as a collective? So again, this is not a subgranting, a deal for subgranting. This should be one entity, and then if they want to hire consultants, that's up to them. I'll try to do 3 more, and then we'll go to reminders. As 49% of funding can be dedicated to evaluation and other services, can CHW-led evaluation organizations apply if they don't hire CHWs directly? I think they would have to, they're eligible, but if it's an evaluation organization, they need to demonstrate how they invest in the CHWPR workforce or provide direct services or provide direct services to the workforce. All right. So for the rest of the questions, 164 that we haven't answered, we are going to add all of them to the Q&A document. And let me share my screen really quick. Okay. All right. So last reminders, the closing date for all questions is Friday, March 13th. So this Friday, you can still submit them through email. And then our goal is to get written responses out by next Friday, March 20th. And we'll send that via the emails that you submitted your questions, as well as all attendees on this webinar will also receive those. And I believe Health Leads is also going to post the Q&A document, and this recording will be sent to all attendees today. So with that, thank you so much for attending, and we're looking forward to seeing your applications and potentially working with you all closer. So have a wonderful day, and thank you so much.